I'm Dr. Pauline Taylor, and I'm a Scottish New Zealander living in Hong Kong. And I've been in Hong Kong almost 20 years now. And I want to make it very clear to everybody, I am not a specialist in animal behaviour. I'm no expert, but I've got a lot of years of experience working with animals and growing up with animals from a very young child. And I want to try and share my experiences as a general practitioner, the same as all you guys in the room here, and how we together can make a difference in animal behaviour. And this afternoon, the key word that most of you are here about is this word called aggression. Terrifying, okay? Aggressive pet, here it is here in English. And what we're going to try and do is work out why the animal is aggressive when it comes into your clinic. And because it's always terrifying, we're always scared when we get an aggressive animal. Nobody wants to get injured, nobody wants to get hurt, nobody wants the animal to get injured or hurt. The clients are always excited as well. So it's a very stressful situation. Everybody's heart starts to go quicker when we get an aggressive animal around us. So the whole point I want you to take home, the take-home message I want you to leave with, is I want you to try and get a better understanding of aggressive behaviour. Understand that behaviour doesn't stop and start, it's moving. There's a sequence to behaviour. And also understand the role of the veterinary surgeon in this sequence. Now, I'm going to show you 3 very short videos, so you can all stand up at the back if you can't see. They've all been taken off the internet, these ones. And it's just to give you a little bit of an idea of why, when the animal gets aggressive in your clinic, there may be part of the reason behind that. Okay, and the 3rd video here, and I've titled this one A Frightened Dog, but this is exactly the type of dog that doesn't want to come in the door of the clinic and can become aggressive and dangerous inside. We're going to go through the background of aggression. And basically the definition of aggression are the feelings of anger, antipathy resulting in hostile and violent behaviour, readiness to attack and confront you. It covers a wide variety of behaviours, a wide variety of behaviours from very subtle to very violent. And it can also be normal or abnormal, depending on what's happening around the animal. And sometimes it's inappropriate, it shouldn't be happening at all. But this is all linked to 4 main things, okay? The behaviour sequence, what's happening around the animal, the frequency and severity of the aggressive events, and the health status of the dog or cat. Remember what it's like when it comes out the car? We're very anxious and things. Okay, so what do we have to do as vets? We must be able to assess the risk of dog aggression and inform our clients what that risk is. And we must be able to understand that dangerousness does not necessarily mean aggression. So in other words, if we've got a large dog, and a large dog runs over, and I'm a large dog and David's another dog, and I knock him over, that's dangerous, okay? But it's not aggression. Okay? What we've got to understand is that if a dog growls and is never bitten, that's aggressive, but it's not dangerous.
So, what is it about the prostate that allows us to investigate and treat it with minimally invasive techniques? And the first of those is its location. So it's in a very predictable place. The prostate doesn't move around. We always know where we're going to find it. It's accessible, so we can often get to it from an abdominal approach or a rectal approach. And the thing about the prostate is as the prostate develops pathology, it always gets bigger and it always becomes more accessible. So, also with the prostate, almost all the diagnostic options that we have can be minimally invasive if we choose them to be. Our treatment options, we can normally choose minimally invasive treatment options as well. So, we have medications. And these days, we're tending to choose a lot more ultrasound-guided techniques to treat prostate disease. Now we're getting better machines, a lot of people getting more trained in ultrasound. And in fact, in our practice, normally for almost all prostate disease, the only thing that we do that is invasive or surgical is castration. So, the symptoms that we see with prostate disease are related to a few things. The first of those is swelling or enlargement. So we think about the way the prostate enlarges and affects the organs around it. Prostate, when it is diseased, often bleeds and causes irritation in the lower urinary tract. Far less commonly, the main symptoms that our patients present for may be related to sepsis. So the prostate is part of the lower urinary tract, so we certainly may expect to see urinary tract signs, and we may see dysuria, stranguria, and pollakiuria, the classic triad, lower urinary tract signs. These signs are most commonly associated when the disease has extended to the bladder. So, more associated with the concurrent cystitis. The bladder and the prostate are intimately associated organs, so pathology affecting one will often affect the other. So, here we can see bladder on ultrasound. We have urine in the lumen, a very irregular, inflamed wall. So this dog had a prostatitis with a secondary cystitis. And this dog had these symptoms of dysuria, pollakiuria, stranguria. Hematuria is a common symptom of prostate disease, and it might be the only thing that dog has. So if we see hematuria with no other urinary tract symptoms, we're really thinking about two things. We're thinking about blood coming from the kidneys or blood coming from the prostate. Now, with the prostate, one thing about the bleeding is that it's often independent of urination. So you may have a dog that is just randomly dripping blood from its penis, nothing to do with urination. So that's a telltale sign of prostate disease. Of course, as part of a thorough physical examination, always important to examine the penis prepuce. Very rarely you may find that there is a lesion, some sort of tumour, TBT, something like that. So, with bleeding from the kidney, as you would expect, you have blood that is generally mixed through the urine fairly evenly, and the blood comes out at the time of urination.